We've studied all the other countries. We've talked to people all across the globe about what they did, what they've done, what worked, what doesn't work, and that has all informed this policy. Two basic rules. Only essential businesses will be functioning. People can work at home, God bless you, but only essential businesses can have workers commuting to the job or on the job. Second rule, remain indoors to the greatest extent to protect physical and mental health. On the businesses, on the valve, we reduced it to 50% of the workforce. We then reduced it to 75% of the workforce must stay home. And today we're bringing it to 100% of the workforce must stay home. These are non-essential services. Essential services have to continue to function. Grocery stores need food. Pharmacies need drugs. Your internet has to continue to work. The water has to turn on when you turn the faucet. So there are essential services that will continue to function, but 100% of the workforce. And when I talk about the most drastic action we can take, this is the most drastic action we can take. We also have specific rules for people's conduct. First is for what we call the quote-unquote vulnerable population. And remember, many people will get this disease. Different countries estimate 70–80% of the population. People will get it, people will recover. That's what's going to happen for the vast majority. That's what's happening in this state for the vast majority. Who are we worried about? Seniors, compromised immune system, people with underlying illnesses. Where are the places we're really worried about? Nursing homes, senior congregate facilities. We need real diligence with vulnerable populations. And there's been a lot of confusion and a lot of different theories and a lot of mixed information. I've gone through it myself with my own family. As I said, we have my mother who lives alone. Everybody wants to help. And we've gone back and forth. Who should go visit mom? Should mom go to my sister's house? Should mom go to this house? Nobody knows for sure. I asked Commissioner Zucker, speak to every health official, get the best rules you can to protect our senior citizens and people with vulnerable populations, and that's what these rules are. Remain indoors, go outside for solitary exercise, pre-screen all visitors and aides, don't visit households with multiple people. Don't go to your daughter's house. Mom doesn't want to be alone. I understand. But you bring her into your house and you have 10 people there and they're coming in and out and your daughters have friends. That is a mistake. That is a mistake. Well, we're going to go visit mom. I'm going to bring the home family to see mom. No, not now. Vulnerable persons should wear a mask when in the company of others. To the greatest extent, everyone in the presence of a vulnerable person should wear a mask. They shouldn't be on public transportation unless it is urgent and absolutely necessary. Well, what does that mean? It means urgent and absolutely necessary. It means what the words say. I call it Matilda's Law. My mother's name is Matilda. Everybody's mother, father, sister, friend in a vulnerable population. This is about protecting them. It's about protecting them. What you do is highly affects their health and well-being. The instinct to love, I want to be with them. I want my kids. Mom wants to see the kids. Be smart. My mother and your mother. For non-vulnerable populations, these are the rules. No non-essential gatherings. Any concentration of individuals is because you're an essential business and an essential workforce. When in public, social distancing at least 6 feet. Outdoor recreation is a solitary recreational exercise. It's running, it's hiking. It's not playing basketball with 5 other people. That's not what it is. It's not laying in a park with 10 other people and sharing a beer. That's not what this is. There are people and places in New York City where it looks like life as usual. No, this is not life as usual. And accept it and realize it and deal with it. Sick individuals should not leave their home unless to receive medical care, etc. Young people need to practice social distancing, avoid contact with vulnerable populations. Precaution